So the last award we'll be giving this evening is for Senator Snowe, and we're going to ask Kathy Hudson of the Genetics and Public Policy Center to come here. And she keeps the story alive in that she was, I never get the position right, some kind of deputy assistant director person thing to Francis Collins at the National Human Genome Research Institute. And Kathy's unique in one way, and that is she was not officially a member of the steering committee because Kathy was first a Fed and then funded by the Pew Charitable Trust, who generously support such great policy work but don't support lobbying people on Capitol Hill. We did award Kathy last year a couple of really nice glasses and a very nice bottle of scotch because we thought that in fact GINA was going to pass soon and that we'd all be sitting on her nice patio around the hot tub drinking this great scotch. And Kathy had to consume it alone in great sorrow that GINA was missed. And so tonight I really want to retain Kathy and give her an award of some very
You see this gray hair on my head? GINA did that to me. This is great. Thank you very much, Sharon. And GINA also caused me to lose my eyesight, which is why I put on my glasses. In 1997, Olympia Snowe received a letter from Bonnie Lee Tucker, a resident of Maine, who herself was a breast cancer survivor and had many family members who had been stricken by breast cancer. Bonnie Lee was afraid for her daughter to have the BRCA test. Bonnie Lee's letter conveyed a mother's fear for her daughter's future, a fear of genetic discrimination. Working closely in the early days with breast cancer advocates and women's health advocates, Olympia Snowe introduced the Genetic Information Non-Discrimination and Health Insurance Act. With Senator Snowe's leadership, a single consensus bill emerged in the Senate, and in the subsequent years, we found that it was hard getting traction to actually pass that bill, but Olympia Snowe remained tenacious. She said, "Genetic discrimination is, by its nature, a purposeful act based on an immutable fact, one's very heredity. To prevent such discrimination from blocking America's access to promise of genetic medicine." Over the years, Senator Snowe has had the help of many fine staff, but perhaps none so dedicated as the genuine, talented, and pleasurable to work with Bill Pewen, who is her senior health policy advisor. He is smart and dedicated, knowledgeable and curious, science savvy. Bill has been involved in every significant and frankly every silly debate and negotiation along the long road that took GINA to reach the White House in May and to bring us together tonight. Thank you, Bill Pewen, for your work, and to Senator Olympia Snowe. Come on, take a picture, Maggie.
One more, just because, oh, okay. 1, 2, 3.
We'll stop. Kathy. Lucky for those who sit at my table.
Thank you, Kathy, and thank all of you for, I don't think any of us can overemphasize the work that you've all done, and how many times, I came here in 2003 to the Hill, as a clinical scientist, not as naive as you can be, in terms of how things really worked here. And so it's impressive to see how many times you've mobilized. I always thought when I came to the Hill, they must plan things on some level, and how many times we've had to call people and say, get ready, it might happen in a few days, in a week, tomorrow. And you got to see the sausage factory, so many of you, up close and personal for so many years. Science is really value neutral. It really relies on us to see that it cuts the right way, and it's not used for harm. Coming from the medical world, we always say the first principle is to do no harm. And Kathy's reviewed the Bonnie Lee Tucker story very well. It's upsetting that so many times, just over the 5 years I've been here, I've heard that same story again and again. Yogi Berra, that it's deja vu all over again. And I kind of want to pinch myself, or maybe you should reach over and pinch someone next to you. Is this really happening, or is this a dream that's finally repeating again? We thought, when I came in 2003, I thought, my gosh, the staffer who's there when this happens, the boss gets all excited, you get sort of the credit for your boss, you got this done. I thought, I really didn't do anything. This is going to be easy. I thought the same thing in 2005. A few weeks, seemed to get it through. Now we get it through the House, and unfortunately our Republican colleagues in the House didn't move forward. Congresswoman Biggert worked very, very hard, and I can tell you on our side too, we had people convinced that you keep prodding away, you keep pushing. After the last election, we sat down and we thought, boy, with all the fractious partisanship, GINA's really the thing. This is the time we're going to be able to get it through the House. Let's sit down, and we're thinking in a few months this will happen. I looked at the speech that Senator Snowe gave on the floor at the time of passage, and I told her, I said, we really didn't have to change part of that, because this one phrase says, for the last 16 months, we've worked to build consensus. And the problem is that some of those people were gone. And when I was on the floor the other day, we were going over all the various bills that had been done. And when you have a member like Senator Kennedy or Senator Snowe, you start looking back at some of those members and not even here with us anymore. Margaret Thatcher said one time, famous for saying, you may have to fight a battle more than once to win it. And you have fought this battle so many times. I think Senator Snowe would compare this to a fear that this was going to become the Peloponnesian War. But it's important to know what you've all accomplished, because without all of you, and without the work that you've done for so many years, we've done something here that's never been done before. We've addressed discrimination before it happens, not afterwards. And that was a real struggle. People would always argue, this isn't really a problem yet. So many would do that. And we did something unique. We didn't just ban the act. We banned the communication, the information on which the act is based. And that's really singular. I'd be remiss if I didn't note that this is the first major health care bill of this Congress. We're still waiting to get that Medicare bill through. We think that's going to happen. We're going to have to override a veto. But that really says so much. And David, I'd like to say the partnership of Senator Snowe and Senator Kennedy together on this bill and so many other things is something we really treasure. And those of you, I think one of the great moments of my life the other day was to be on the floor of the Senate as we struggled for a year to bring the Medicare bill to the floor. Senator Snowe managed to bring 9 Republicans forward. We had 59 votes. And for those of you, I'll have to share the DVD. I'm probably going to have a tough time as David here. That moment on the floor when Senator Kennedy walked in. And of course, I work for a member, and mainly don't miss votes. You come and you vote, you come and you represent the people. And you come to get something done, not just to make a partisan point. And the feeling in that room was something I will never forget. And the service that your boss, Senator Kennedy, did that evening too, made a difference to millions of individuals. The way we work. I'd like to say, I know Dave knows this, and any other staffer on the Hill, that you move from one issue and you hardly take a breath before you go on to the other one. Winston Churchill, I was thinking about a quote I heard of his again the other day. This is not the end. It's not even the beginning of the end, but it's the end of the beginning. There's much more we need to do. This bill will make such a difference now enacted in terms of those who have not yet developed disease. But for those who have existing disease, there's much more we need to do. And Senator Snowe is looking forward to working with all the other sponsors and all of you to realize that dream. Thank you all so much for all that you've done and for this award.